like to welcome all of you to our satellite session today, which is part of the CUGH Annual Conference 2021. And we are happy that so many of you are joining us today from all around the world for this online event, which will present various regional and global perspectives on climate change and health, with a special focus on adaptation and mitigation solutions. This event is organized by the Global Network of Science Academies, called IAP, in collaboration with the regional networks of science academies in Europe, Asia, Africa, and the Americas. You will hear a little more about IAP and its regional networks shortly. Before we start with the presentations, I would like to introduce you to our speakers and our agenda for today. I will stop sharing my screen for this so you can get an idea of who we have here. We have Professor Andy Haines. Andy, if you could turn on your video so that everyone can see you for a second. Andy Haines is Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine and one of the two co-chairs of our IAP project on climate change. He's also currently the co-chair of the Lancet Pathfinder Commission on Health in the Zero Carbon Economy. Then next up, we have Deoraj Caussy. Deoraj, could you turn on your video for a second? Deoraj is an epidemiologist from Mauritius who will be representing NASAC, the African Network of Science Academies, today. Next up, we have Ismail Koyuncu. Ismail, if you could turn on your camera for a second. Professor Koyuncu is president of the Istanbul Technical University and member of the Turkish Academy of Sciences, and will be representing AASSA, the Asian Network of Science Academies, today. We also have Robin Fierce. Robin Fierce is the scientific coordinator of the IAP project on climate change and health, and also director of the Biosciences program of EASAC, the European Network of Science Academies. We also have with us today Sherilee Harper. Sherilee is a Canada Research Chair in Climate Change and Health and an Associate Professor in the School of Public Health at the University of Alberta. She will be representing IANAS today, the Network of Science Academies in the Americas. And last but not least, we have Professor Volker. He is a virologist by training. He is the current president of the InterAcademy Partnership and chairman of the Biosciences Steering Panel at EASAC, which is the European Network of Science Academies, and he's the other co-chair of our IAP project on climate change and health. During the breakout sessions later, you will also get to meet some of our colleagues from IAP and EASAC who will help us with moderating and reporting. Now I would like to share with you our agenda for today. As you can see, our program today is divided into three parts. In the first part, we will listen to presentations given by our regional representatives on climate change and health in the different world regions. We will also have a short panel discussion during this part. Then we will have a short break. In this break, we ask you to switch to a second separate Zoom meeting. I will explain this later, to enable us to host breakout discussions so that we can get into an actual discussion with you. And then for the last part, we will come together again in this webinar to hear about what was discussed in the meeting and the other breakout sessions and to come to a conclusion. Before we start with the presentations, I would also share with you a few technical remarks. Please use the regular chat for general queries, or if you have IT queries, you can see the chat bar in the lower part of your screen on the left. If you have any questions to the speakers or would like to know a bit more about their presentations, please use the Q&A tool, which you will find on the right-hand side. Please don't be shy to ask questions. Our speakers are very happy to answer any of the questions you may have for the presentations. You can do that at any time during the presentations, after the presentations. Just use this Q&A tool for that. And I already said that for the breakout sessions, we will need a separate link. This will be shared in the chat, which you will also which you can open by clicking on the chat symbol. The very last item I would like to mention before we start is that now I talked a bit about ourselves, but since this is a webinar and it's sad that we cannot actually see you, we would like to know a bit about you. And for this, I prepared 3 short questions. First, I would like to know from you where you are from. So I will share with you now, just if you could give a short, quick answer so we know who is in the room today. Okay, I will, not everyone has answered yet, but I will just finish this for now. So we see that 35% are joining us from North America. We have 20% from Asia, 27% from Europe, some from the Middle East and Sub-Saharan Africa. No one from Oceania, but I guess this is also due to the inconvenient time difference. Now, just a short second question I would like to know is, where do you work and what is your field of work? So we know what is the background, professional background of our attendees. Okay. So the overwhelming majority is from academia. We also have a few representatives of national governments and national agencies. NGOs are also part, and also a few representatives from industry. And now the very last question is with regard to your expectations for this webinar. What are the reasons that you joined this webinar? What do you wish to gain from it? Okay, so answers are quite mixed. I'm assuming many people also clicked on more than one option. So generally a better understanding of how climate change affects health in different world regions, and also the wish to gain new ideas and approaches for adaptation and mitigation strategies. So I hope that we can meet some of these expectations now during our webinar. And with this, I would like to hand the word or give the floor, so to say, to our first presenter, which is Professor Volker Meulen.
Okay, can I start, Johanna?
The floor is yours.
Okay, thank you very much. Dear colleagues, it is my great pleasure to welcome all of you participating in this webinar. Although I assume you have been using this technology a lot since we started fighting the COVID pandemic, for me, it is still a strange situation and I did not get used to it, to have no personal contact with the audience that we are addressing in our workshop. Today, we want to discuss with you our project on climate change and health. But before we start, I would like to introduce to you IAP, the InterAcademy Partnership. Since probably not all of you are familiar with this global network of academies of science, medicine, and engineering. IAP was founded in 1993 with the idea to bring all the national academies of science, medicine, and engineering together so that their voices are not only heard at home on a national level, but also regionally and if possible, globally. The first office of IAP was at the Royal Society in the UK. After the move of IAP's headquarters from London to Trieste in Italy to the Academy of Sciences for the Developing World, 4 regional networks of IAP member academies were founded. And in the next slide, you can see how they are distributed. There are a network in Asia, which is the Association of Academies and Societies of Sciences in Asia. You can see them on the right-hand side. Then in the middle, you will have EASAC, European Academy Science Advisory Council of Europe. And then in Africa, you have the network of African Science Academies. And on the left-hand side, you see the North and South Americas, IANAS, which is the Inter-American Network of Academies of Sciences. And in these networks, the regional activity is grouped together. And altogether, we have 140 member academies, which then represent more of about 30,000 leading scientists and engineers, a high concentration of knowledge, and of course, health professionals as well in over 100 countries. Now, in the next slide, you can see what are our priorities. And these priorities are actually 4 different areas. To build the capacity of our member academies and regional networks, and this includes many things. For example, that our academies represent women scientists and younger scientists and scientists from different backgrounds as well. That there's support for the engagement with wider civil society, policymakers, and media, or providing platforms for an exchange of good practice by the academies in the midst of the COVID-19 pandemic, for example. And the second, so the idea was, and the strategic priority is giving us authoritative and independent advice. And this, of course, is very important from a science point of view. That it means empowering our academy to engage on different topics that are of relevance to society and to its sustainable development on the basis of the best independent and up-to-date scientific understanding. But we're also interested, as you can see in the slides, to communicate the importance of science to our societies. IAP has doing this successfully for many years, where, for example, one successful and highly inspiring programs on the need for good science education in schools over many years. And of course, our engagement on societal issues, such as the COVID-19 pandemic, from the perspective of science, underscores the importance that we attribute to science as a vital pillar of any sustainable society. And lastly, IAP strives to be a well-functioning, progressive, and resilient network of its members. This maybe sounds trivial to you, but given the global nature of our organization, it is not. A lot of intracultural learning takes place in IAP. And I think this kind of learning, the globe will need to achieve a sustainable future for humanity. After many years in IAP, I can say that I'm very happy about this global path taken by all the academies together. I will give you some example of our activities in relation to this strategic priority. And on the next slide, you can see that we have dealt with, of course, in the pandemic, with COVID-19. And IAP has put a group together by sending a call to all our member academies, and we got about 80 experts together from the different bioscience and medical fields, which are coming together, giving advice to IAP, to the member academies, which have problems. And this group is shared by 3 women as co-chairs. We also have in our website the possibility that our academies can not only consult, but only provide their important findings which are of interest to our networks. And in the next slide, you can see that we also started an IAP communique on the development and distribution of vaccine against COVID-19. We all experience right now that there is not enough vaccine available globally. And that certain countries, try to keep them for themselves and not trying to share them with others. And this probably will only be solved once we have more or a surplus of vaccine, but this will certainly take a while. And of course, in this context, we are not only addressing this issue, but also fighting fake vaccine medicines and also fake news, something which is so important that science is getting in contact with these questions. And I can tell you some additional IAP communiques we have published over the last month and also last year. We had a call for global solidarity when we realized, for example, in March last year, that every country was only concentrating on its own problem, and it was entirely forgotten that the pandemic is a global event. And in contrast to the Ebola situation, where we had a leading country like the US, at that time to have concentrated action in the pandemic, we failed. And this was something we got aware of, and we then published and put pressure on different organizations. We also had to publish achieving the public health potential of COVID-19 vaccines. How important it is that medicine plays an important role, but we don't have to go into further detail with this. Or we had a communique on the global green recovery after COVID-19. In other words, that we all already raised questions when the pandemic is really coming to an end, or we see light, not only light in the tunnel, but that things are improving, that we should not forget that we have a climate problem which has to be addressed, and we can learn something from COVID, which we could apply in our climate situation. And the next slide, I can show you that there we also gave some advice in science education. Together with the Smithsonian Institute in the US, we produced documents on food and nutrition security. We addressed also, for example, the mosquito situation when we had the Zika virus infection in South America. Something which I think is important that scientists don't forget, that it would be good to educate young people so that they get not only interested in science, but that also the information of science is spread in a wider society. Next slide, please. So in addition, of course, we also take to enlarge our group and our membership. We are also trying to start new academies in developing countries, and we have new members, as you can see, in Algeria, Rwanda, Tunisia, which just have joined our activity. Next slide. Now, I mentioned in the beginning that the regional networks were actually started, that in the region, in the continent, also science work together and addresses together important issues which are of interest to society, but also in particular of government and politics. And I also mentioned that we are trying in IAP to bring these regional networks together so that important global questions are addressed together by the 4 regional networks, by these 4 huge continents, so that they bring in their knowledge and that this knowledge is available not only regional, but globally. And we started a couple of years ago a topic of food and nutrition security and agriculture. And what we wanted to achieve was to have 4 regional reports on the same issues. Issues means in this way that we define 10 major scientific questions which are important globally for food and nutrition security and agriculture. And we discuss this together. These region produced reports, regional reports, 4 reports on this issue. And out of the 4 reports, we produced a 5th report, a global report, in which these 10 questions and the answers, in particular the answers and responses and the suggestion of scientific advice giving to these problems, were compared. And it was an eye-opening to, of course, for politics to see that these questions were in a different way answered, depending on the region, depending on the situation in the region, and depending on the culture. And this was quite an eye-opener to politics. And I just can say, for example, that with the report of these 4 regional reports plus the global report, we were invited by 2 years ago to the S20 meeting in Argentina, where we presented this to politics and to a great audience. And also the United Nations is still interested in this because IAP has been invited this year to participate at the UN Summit on Food Safety and Food Security, which takes place at the end of the year. And we are asked to give an update of our reports so that it is up to date and can be used and presented there. So, may I have the next slide? This is actually what I wanted to tell you. I hope we will have a very interesting discussion. Climate change and health is a similar project like food and nutrition. And Robin Pierce, I think, will give you all the details of what we are doing in relation to climate change and health right now with our networks of IAP. Thank you very much.
Thank you very much, Professor Meulen, for this short introduction to IAP. And with this, I will give the floor, so to say, to Robin Pierce. And for this, I will share my screen once again so we can listen to his presentation on our global IAP project.
Hello to everybody. I'm Robin Pierce. I'm based in the UK. And please let me first join in welcoming you all to this satellite event. You've already heard something about the InterAcademy Partnership, IAP. My purpose in this presentation is to introduce you to our global project on climate change and health. It's based on the activities of 4 regional groups who will all be presenting later in this session. Our aim is to share knowledge between the different regions and stimulate discussion with you all. Our focus is particularly on the diverse solutions for mitigating and adapting to climate change for health in order to protect and promote human health. Okay, this slide is taken from the work of the US CDC and portrays the diversity climate change challenges we all face, various exposure pathways, diverse effects on health. Other presenters will describe many of these risks and how we should respond to them at the regional level. What this slide doesn't show is the particular vulnerable groups because of geography or socioeconomic status or something else. And we'll also discuss those during the course of our presentations. Broadly, we categorize climate change effects and exposures in 3 categories. Direct effects, for example, from extreme heat. Indirect effects mediated by ecosystems, so for example, changes in agriculture. And thirdly, indirect effects mediated by socioeconomic system changes, for example, declining labour productivity. You'll hear more about these later on. Now, in terms of the IAP project, in summary, this is a global scale. It's based on 4 regions: Africa, Asia, the Americas, and Europe. And the work from these regions is being used to engage at national and regional level with stakeholders, the scientific community more broadly, and other stakeholders. In addition, our regional outputs will also be used as a shared resource for generating a global analysis and synthesis. The project is co-chaired by Volker and Andy Haines, who are also speaking today. Okay, clearly there's a lot of other groups involved in these areas on climate change and health. Many excellent groups delivering important recommendations for some of these same issues. So how does our IAP approach add value? I want to emphasize the inclusivity. We're inclusive across diverse scientific disciplines, taking a transdisciplinary approach. We're integrating analysis and activity at local, regional, global levels. We focus on vulnerable groups, indigenous people, and other local activities. We're also inclusive in involving younger researchers. And our project over the next couple of years serves also as a basis for longer term follow-up in engagement and analysis. So that's what we are. This is our membership. I just want to remind you again, you've probably already seen this, of the global scale, and we're able to bring together diverse perspectives from across the world in two main areas. That is, what do we need to do to build a robust scientific evidence base and share that knowledge worldwide? And secondly, how best can we use that evidence to inform policy and practice? So there are our objectives. And although worldwide we share challenges for climate change and health, clearly there's a great diversity both within and between regions. So in order to generate coherence for our project, the 4 regional work streams in Africa, Asia, Americas and Europe agreed some common starting points to describe the effects of climate change on health in their own regions, to focus particularly on what the solutions might be for adaptation and mitigation. Mitigation is reducing greenhouse gases, which in some cases brings co-benefits for health that we'll talk about. And adaptation is adapting to the effects of those effects of climate change that cannot otherwise be mitigated. So our focus is on solutions, but in order to derive solutions, we also need to improve and share the evidence base. We need to link the work locally, globally, and regionally. And we need to link also what we're doing with other current policy initiatives. Sustainable development goals are perhaps one of the best examples of large initiatives elsewhere. But in addition, in this year, we're looking forward to COP26 of the UNFCCC and the UN Food Systems Summit. There's a number of relevant activities at the international policy level. I won't go into further details as to what we've actually done or are doing, because you'll hear that very soon from the other speakers. I just wanted to spend a couple of minutes instead providing a little bit more of general context to the project and our objectives. And first, this slide from the Climate Action Tracker Group worldwide. I want to look at some of the issues for mitigation to reduce greenhouse gas emissions and achieve the targets within the Paris Agreement for a 1.5 degrees centigrade or maybe a 2 degrees centigrade world. This slide lists some of the near-term priorities for mitigation by action on fossil fuels, transport, agriculture, building, renovation, and so on. My point is that when considering these options for mitigation, it's very important also to include the consideration of the near-term health co-benefits in these mitigation actions in order to help prioritise decision-maker focus on what can be done now. For example, phasing out fossil fuel combustion, in addition to reducing greenhouse gas emissions, will also decrease air pollution. And as a consequence of that decreasing air pollution will bring early benefits to health, for example, diminution of respiratory and cardiovascular disease, development disorders, and so on. These are near-term health benefits, particularly for the group locally engaging in the mitigation action, and they complement the longer-term benefits arising from global warming itself. Now, you'll hear more about these co-benefits in various areas in the next few presentations. And my other main point is to observe that we live in a world with converging crises of climate change and COVID-19 at the moment. But both these crises, that is climate change and COVID-19, have found the world unprepared. There have been very high public health and economic costs for both crises. And in some respects, there are interactions, for example, at the level of food supply or emergency responsiveness. My point is that in planning for a sustainable recovery after COVID-19, we now have a singular opportunity to convince policymakers to take the opportunity to look for and plan for benefits for health, the environment and equity, in addition to the economic benefits that will be expected to arise from a recovery. Now, this slide shows public opinion survey noting very high levels of public support for a green economic recovery from COVID-19 around the world. And collectively, we in the scientific community have a responsibility to help keep informing with our science, monitoring and auditing the policy actions in order to sustain the green economic recovery. Okay, so in conclusion, just coming back to the purpose of this session, over the next few minutes, you will hear the evidence from the 4 regions as to what we've been doing with this project. We very much want to stimulate feedback and discussion with you in the audience, both during our Q&A sessions and in the breakout sessions that you'll be participating in later on, in order to provide feedback to the members of the project with regard to the ongoing directions for the project, and in particular to bring attention to bear. What more evidence do we need? How can we prioritize the solutions in terms of adaptation and mitigation? What are the common issues at the global level? What varies between the regions? And how can we all work together? So I finish this presentation. I thank you for your attention, and I thank our sponsor in the German government. I also mentioned that the next short presentation will also be by me, when I will go on to describe some of our work in Europe. So thank you for your attention so far.
Yes, thank you, Robin, for this short presentation. And now we will go right into the first region, which is the European region. And in order for you to view this, I need to share my screen again, which I will do just now. And just to encourage you, if you have any questions to the speakers, just write your questions in the Q&A and we'll come back to those later on during the discussion and the feedback round.
So following on from my previous presentation about IAP, I now want to spend a few minutes giving the perspective from Europe on the issues that I mentioned regarding climate change and health. In this presentation, I draw on the work by EASAC, that is the European Academy's Science Advisory Council. And the work by EASAC started earlier than in the other regions, and the actual report has been published a year or so ago and is available on the EASAC website. So I commend this report to you for detail on the points that I'll be presenting and on a number of other topics. What did we find in our EASAC work? This slide summarizes the 4 main areas for recommendations to policymakers in Europe. We advised much more needed to be done to link the outputs from research with the development of policies, particularly in terms of finding solutions, adaptation and mitigation, and doing it in a coherent way so that we minimize unintended spillovers or consequences of acting in one area on another area. So linking. Secondly, communication from the scientific community in order to inform behavior at the individual, company, institutional level, and also countering both misinformation and indeed disinformation in this area. Scientific community has a responsibility to clarify and engage. In thinking about how we can use evidence for policy development, there's 2 points, my last 2 bullets. One is we must already do better in using the evidence that's available now to make the case for health in all policies, across sectors, across disciplines, and of course aligned with policy initiatives that are already underway. And we have a number of those in Europe. But in addition, we need to generate new evidence, that is to fill the knowledge gaps so that we can better inform policy and practice using the best research. And one of the areas where we need to fill knowledge gaps in Europe and elsewhere is on some of the vulnerable groups, and I'll come back to that in a minute. In my following slides, I'll exemplify two areas from our EASAC report where we have been generating and using the knowledge. So first example is in agriculture and food and nutrition security. Now, in Europe as well as elsewhere, climate change is already damaging food and nutrition security. How should we respond to those adverse effects, both in terms of mitigation and adaptation? Well, in Europe, the effects of climate change on agriculture do vary across the continent and are projected to continue doing so. In some areas, for example, crop yields may even increase because of warmer climate. But overall, for the European region, we do find a current decrease in yield of cereals, for example, and in both yield and nutritional quality for fruit and vegetables. And these adverse changes are expected to continue. There's multiple pathways for these adverse effects. It's not just increasing heat and drought, but it's also, for example, increasing the distribution of pests and diseases for both crops and livestock. And remember, the effects on agriculture in Europe may be exacerbated by a reduction in food imports from the rest of the world, which is affected even more severely by climate than is Europe. Well, it's a complex situation. Again, I summarise it in the first bullet. We're already seeing changes in cereal, fruit and vegetable quality. The pathways are complex. What can we do about this in terms of adaptation? Well, there's some great scientific opportunities to develop climate resilient agriculture. Our EASAC report goes into the detail. I want to give just one example here, drawn from biosciences research, and in particular, the new genomic technologies such as genome editing that can underpin the development of improved crop varieties resistant to biotic and abiotic stresses. These promise to provide a major contribution to climate resilient agriculture. But they require not just cutting edge research, we have that, they also require a supportive regulatory framework to encourage innovation in the new breeding techniques. Europe currently does not have this, so we have a disconnect between our ability to do the science and the ability to turn that into innovation and connect to practice for improved agriculture. Also, adaptation is not enough in this area. Agriculture itself contributes in a major way to greenhouse gas emissions. Approximately 30% of the total greenhouse gas emissions worldwide are contributed by agriculture itself and land use changes associated with agriculture. A high proportion of that comes from livestock farming. The contribution from agriculture can be mitigated and will make a big contribution to mitigating total greenhouse gas production. A number of options are possible. Clearly, we need to reduce food waste. We need to improve farming practices in various ways. And there are examples of good practice that we can share. And also, we need to consider a particular focus on those areas of farming that are contributing most to greenhouse gas emissions. And in Europe, that's livestock and dairy farming. So that in Europe, attempts to decrease the consumption of red meat when that is excessive in populations and adopting more plant-based diets serve as a means to reduce greenhouse gas emissions from livestock. And in addition, also provide a means to capture the health benefits because of the reduced incidence of non-communicable diseases that would be connected to reduced red meat intake. Now, these propositions for Europe may not be applicable everywhere, of course, and we do need to act to protect vulnerable groups who may already have low intakes of micronutrients. And of course, in other regions, the debate is also quite complex in terms of customizing diets to appropriate circumstances. My second example is infectious disease in Europe. These also are showing significant changes currently in association with climate change, and the adverse consequences are projected also to increase. There are examples of diverse pathogens affected by climate change. In many cases, the exposure pathway is via an increased distribution of the vector or pathogen, but other climate effects can exacerbate these broader changes. For example, flooding may produce local and transient additional environments for vectors. This slide, taken from the European ECDC, focuses on West Nile virus. The data are at the end of last year and show a continuing trend for expansion of West Nile virus across the European region. The incidence and the distribution do vary from year to year, but over the last few years, there has broadly been a continuing westward and northward expansion of West Nile virus, and that will continue throughout Western and Northern Europe, we believe. Tackling the growing challenges from infectious disease requires multiple approaches to adaptation, requires better monitoring and early warning systems, for example, and there are ways of instituting and sharing good practice in early warning systems. It also requires renewed commitment to novel diagnostics, therapeutics, and vaccines. In my next slide, I mention a particular concern with regard to the Arctic region. This recent publication came from a workshop organized jointly by EASAC with the US academies and IAP to focus on microbial threats in the Arctic, in particular, the potential re-emergence of anthrax from thawing permafrost in the Arctic, and the Arctic is warming at a rate much greater than some other regions. So potential emergence of anthrax and also identification of previously unknown bacteria and viruses in the Arctic. In addition, the rapid warming of the Arctic is associated with potential for spreading previously established infectious diseases, including tick-borne diseases, malaria, West Nile virus, and Vibrio species. These changes present problems for the indigenous communities across the Arctic region, but also to their neighbours and potentially globally. The conclusions from our discussions on the Arctic are obviously of great relevance to the community in the Arctic, but also we feel maybe generalizable for elsewhere in Europe and indeed the rest of the world. And these conclusions are discussed in detail in the workshop report, but broadly we emphasize the need to engage with local communities and use local knowledge, the need for better surveillance, and that may include taking a One Health approach to surveying and responding to disease both in public health and in animals for livestock or wildlife. It's important in the disparate area that represents the Arctic to share research data and technologies and work together across a number of different countries in the region. It's also important to use those emerging data to inform policy in the different countries of the Arctic region and overall in collective endeavours in the Arctic. And finally, I want to emphasise the importance of investing in basic research. There are a number of issues for infectious diseases in the Arctic. We need to know more about the determinants of transmission, both within species and between species, and the determinants of pathogenicity. Of course, these objectives are highly relevant, not just for the diseases described in the Arctic, but also, for example, in our recent experience on COVID-19, where there's a great need to understand determinants of transmission much better for COVID-19 and for preparedness for future pandemics. And let's move to my last slide, which tries to bring together some of the issues for the converging crises of climate change and COVID-19 that I mentioned previously. In some respects, they share common issues. Both crises revealed a lack of preparedness in many of our countries. Both have disproportionate effects on vulnerable groups. The effects may be compounded by climate change and COVID-19 together. There are, of course, relevant issues for the next generation of novel pathogens, whatever they may be. But finally, on this slide, I want to emphasize there's also an opportunity. The opportunity to put in place post-COVID-19 sustainable recovery options to gain benefits, not just for economic recovery, which we all want, but also for health, equity, and the environment, to tackle climate change and the other environmental consequences. As I showed in my previous PowerPoint presentation, there is public support for pursuing these low carbon pathways post-COVID-19. And we do now have an opportunity and a responsibility in the scientific community to act with urgency to advise our decision makers on how they can move forward. I'll finish here. Thank you very much again.
Yes, thank you, Robin, for also this second presentation on the European perspective. Now we will move forward to listen to the Asian perspective presented by Ismail Koyuncu, and I will also share my screen for that. Just 1 second. Yes. And as always, you're welcome to write any questions in the Q&A tool, and we will address those right after this presentation on Asia.
My name is Ismail Koyuncu. I'm the member of Turkish Academy of Sciences, and also I'm the president of Istanbul Technical University. And I am the member of Climate Change and Health Commission of AASSA. Today, I will talk about regional perspective from Asia on climate change and health. There was a meeting a year ago in February 2020 in Malaysia, Kuala Lumpur. Scientists from different regions of Asia attended to this meeting, and we discussed climate change and health in AASSA countries. And now we are preparing a report for as AASSA, and this report will finish in very soon. Asia is a disparate continent with extremes of climate, and therefore a variety of health effects from climate change. And some countries are relatively less affected, and to those which are severely impacted. There are different multiple pathways and effects. Direct heat effects, for example, on cardiovascular disease, indirect heat effects on labor productivity, and flooding infectious disease. And air pollution is very important in Asia due to burning of forest and pollution, and also migration of vectors and pathogens from neighboring countries, and mental health, allergy, food and nutrition. These are all very important in Asia countries. Air pollution is major public health issue in Asia countries. The sources of air pollution, is coming mostly from the fossil fuels and wildfires and agricultural practices. There are some solutions, case studies in Asia countries to decrease the effect of air pollution. For example, renewable energy production and also using another issues for fossil fuels and prevention of forest fires, and also decrease the air pollution from public transportation. Australia experienced very big wildfire in 2019 and 2020. The scale and intensity of this fire season presents an opportunity to address the knowledge gap. Flooding is also an increasing problem through Asia region. And in most countries, because of flooding at short-term, waterborne and waterborne diseases, and the drinking water quality is affected. In longer term, degraded ecosystems, mental health impacts, and also there are some economical impacts of flooding. Malaysia is the country experiencing flooding too much, and during the next 100 years, the flooding may increase in Malaysia cities. And also in Turkey, here you see during the last 20 years, the number of extreme weather events increasing. And it is reported that this will continue to increase. And refugee problem, it's a big problem in Asia continent. And in Middle East, in South Asia, there are different refugee problems. In Turkey, 5 million Syrian refugees are living in these camps. And because of, it's very dense population is living in these camps, there are too many disease related with living each other. Oriental boils, hand, foot, and mouth disease, these are the frequent disease found in migrants. And in Asia report, we are advising to continue analysis of solutions and sharing good practice in Asia countries. Here, adaptation is very important, integrating local national actions, strengthening health services and other infrastructure, increasing public awareness and education, early warning and surveillance systems, and control of infectious disease. In Turkey, the national program and action plan on climate change and health approved in January 2015 by the Minister of Health. And there are 4 working groups obtained: Health Indicator Commission, Early Warning and Response Commission, Research Orientation Planning, and Risk Management. In line with the work of commissions, targets were set, strategies were determined, and activities were listed. And here, there are too many training meetings, congresses on water and health, urban environment during the last 5 years. And also, there are studies by the Ministry of Environment on education modules of climate change, and there is one module is related with the climate change and health in these education modules. There are also very good case studies on early warning system at the south west of Turkey in one city in Aydın. There is a pilot study of early warning of climate change. With this project, a web page is organized, and with this project, SMS messages is sent to the people for the extreme weathers. And at the end of the study, it was observed that the stimulation of digital media creates awareness in the participants and positively affects their attitudes and behaviors. Steps for Turkey's adaptation process. Trainings is very important for the future, and studies on health-sensitive groups should be increased. It's very important. And here you see health-sensitive, living on street, homeless, living without social support, infant, child, elderly, pregnant, women, groups with dysfunction. Early warning systems should be also developed for all region. It's very important to decrease the effect of climate change. Local level arrangements and activities should be urgently adopted, and awareness raising should be given priority. The emergency response mechanisms should also be developed. Another important thing is information. I think there is a lack of statistical information about climate-related disasters. That's why the establishment of center or institute on these should be should be done. And this is my last slide, and thank you very much for your attention. And if you have a question, I will be very happy to answer.
Yes, thank you also, Professor Koyuncu, for this presentation on the Asian region. Now we have scheduled a few minutes for immediate questions from the audience that may have come up. And I already saw that we had one question, which I would like maybe to direct to Robin. Robin, if you could turn on your video. Yes, thank you. So Kathleen Michaels is asking about the role of plastic production. She says, plastic production and use is a huge driver of climate change throughout the life cycle, including emitting methane and ethylene, sorry if I did not pronounce this correctly, when exposed to sunlight, and she's asking for a comment on this.
Hey, thank you for the question. Thank you, Joanna. And I think, yes, we can all agree that plastics production and use generate a number of challenges for society in terms of manufacturing processes and climate change, as you mentioned, and also, of course, contributing to other environmental damage. In fact, we've had recent work by EASAC, European Academy Network, to look at issues for plastic pollution. Details on your screen now. And I'd refer you to that work for further detail more broadly about issues for plastics use. I'd make two other points, so just very briefly. One is I think the issue for plastics exemplifies one of the issues that we're emphasizing throughout this meeting, the need to integrate objectives and actions across sectors. So an interest in health doesn't mean merely action within the health sector, but also taking account of health and other issues in other sectoral action for manufacturing, for energy, for agriculture, and so on. And that applies equally to plastic production. But the second specific point is that the health sector itself is a big user of single-use plastic products disposed and not recycled. And health systems themselves are rapidly beginning to address their own carbon footprints with ambitions to decarbonize. In the UK, we have a pioneering position from our NHS, but good practice is being shared amongst institutions worldwide in the health sector. And amongst a lot of the embedded carbon in the healthcare sector is the supply chain, including the supply chain of single-use plastic products. So there's a great need, specifically within the health sector, to look at the opportunities for recycling or replacing plastic products. And the European academies will be publishing a commentary on the health sector decarbonisation within the next month or so. So I urge you to look forward to seeing that. Thank you.
Thank you, Robin. Donna Hackley is asking about the specific references. Christiane Diel already posted one reference, the reference to the EASAC report in the chat. So you can take a look at this. And if you need any further reference, we're also happy to provide them with you. Just send us an email and we can share this with you. And then we have also one question to Professor Koyuncu. If you could turn on your camera. The question is heat-related illness a major issue in the Asian region? If you could answer to that.
Yes, there are some reports giving a point on this issue. There may be direct heat effects and also indirect heat effects. With direct heat effects, there are some statistical informations with the according to these informations at high temperatures, the mortality numbers are increasing. And also there are some reports reporting some cardiovascular disease with during summer season, they are increasing. Yes, we can say that heat is affecting the illnesses.
Thank you for this answer, Professor Koyuncu. In view of the time, I will keep the other questions that were raised for now. You might be able to address them later or give an answer just in the Q&A tool. Thank you already for the questions asked so far. And now we are moving to the other two world regions that we haven't covered yet. And we will start with the Americas. And for that, I will share my screen once again to show you the presentation given by Sherilee Harper.
My name is Sherilee Harper, and I'm a Canada Research Chair in Climate Change and Health at the University of Alberta in Canada. And it's such a pleasure to be here today to tell you about our report on climate change and health, which focuses specifically in on the Americas. And I'm here today on behalf of a much larger team, which is co-led by Dr. Jeremy McNeil, as well as a number of other steering committee members from countries across the Americas, including Argentina, Brazil, Costa Rica, Guatemala, Mexico, and the United States. And our team is growing every day. Like elsewhere around the world, climate change is having a variety of different impacts across the Americas. From the IPCC Fifth Assessment Report, there were projections of increased temperature across the Americas, and specifically in North America, we're expecting to see a 2 to 4-fold increase in the frequency of heatwave events by the end of the century, as well as increases in precipitation and heavy rainfall, especially in the northern regions of North America, and increases in drought frequency in the southern regions of North America. And we know that every single bit of warming matters in the Americas. Here in these graphs, you can see climate features under 1.5 degrees of global warming versus 2 degrees of global warming. And we can see a pretty substantial increase in the change in average temperature of the hottest days. We also see a huge change in the average temperature of the coldest nights in the Americas. For example, in the Caribbean, warm spells will occur 50% of the year under 1.5 degrees of warming, and that will increase to almost 70% of the year under 2 degrees of warming. In the Arctic, under 1.5 degrees of global warming, we would expect to see an ice-free summer once every 100 years, but under 2 degrees of warming, that would increase to once every 10 years. These are substantial changes that have huge implications for cultures, for society, and for human health. And the impacts to human health from climate change are incredibly diverse throughout the Americas. When our team sat down to try and decide what we were going to focus on and how we were going to shape our report, we were faced with a huge challenge. The Americas have a diversity of projected future climate changes. We have a diversity of different climates. We have a diversity of cultures and languages. We have different political systems. We have differences in access to resources, including high, middle, and low-income countries. And we also have different underlying health challenges. And these all impact how climate change is going to impact the health of people in the Americas going into the future. And so we felt that this challenge was huge, and we really questioned how we were going to do this concisely and effectively and in a way that was useful for policymakers and decision makers. So how did we do this? So what we decided to do was focus on climate change and health syntheses, and these include both international assessment reports, national assessment reports, right down to local level assessment reports on climate change and health. We also drew a lot on systematic literature reviews as a source of evidence. To advance where previous reports had left off, we decided to really provide a strengthened emphasis on the local context and also impacts of non-climatic variables. This included in-depth case studies to highlight regional climate health impacts and responses. We decided we really wanted to have a very strong focus on equity. We decided to prioritize Indigenous peoples and Indigenous knowledge in our report. And we also wanted to really highlight community-based research approaches throughout the Americas. So in our report, we have two main sections. The first section focuses on the health impacts, and the second section focuses on synthetic recommendations for adaptation and mitigation. In the health section of the report, we look at health outcome by health outcome, and we look at the current status and impacts with examples. We also look at different projected impacts on health outcomes, and we look at those under different climate change scenarios. We look at those under different adaptation scenarios and strategies, as well as under different shared socioeconomic pathways forward. We also look at adaptation and mitigation strategies that are specific to those health outcomes to add a level of depth and granularity. And finally, we look at case studies. And the case studies really help illustrate what climate change impacts on health look like and what they feel like on the ground throughout the Americas. So here are some examples of the different health outcomes that we focused on. We looked at how climate change is impacting heat-related morbidity and mortality. And the different morbidities range from things like heat exhaustion to heat stroke, to cardiovascular challenges, the more typical things that you might think of when you think about heat exposure and heat stress. But we also look at the more not so common to think of health outcomes that are related to heat exposure. And that includes things like low birth weights, as well as increased suicide. For instance, we look at case study examples in the United States, Mexico, and Brazil, where increased heat exposure led to increased rates of suicide. We're also looking at respiratory health and wellness, and this is a result of things like exposure to pollution, as well as things like increased exposure to aeroallergens, among other things, with specific examples from the West Coast in Canada on how increased wildfires are also increasing respiratory distress. We're looking at different infectious diseases, including waterborne disease, foodborne disease, vector-borne disease. We have a section on nutrition and food security with specific examples throughout South America and Central America, but also examples from Indigenous communities throughout the Americas. For instance, Indigenous communities on the west coast of Canada really rely on seafood as a primary source of nutrients and nutrition for those local communities. And we know that under climate change, seafood availability will significantly decrease because of warming waters. And this will lead to a 21% decline in nutrient intake for those communities. However, under a high emission scenario, this decrease in nutrient intake will actually increase to 32% reduction. We have a substantial section on mental health and wellness. And this is a cross-cutting health impact because climate change impacts mental health in a number of different ways. And finally, we also look at climate disasters, including injuries and unintentional death. But across all of these health impacts, what we really try to illustrate in the Americas report is cross-cutting themes of how all these different health outcomes are actually modified or mediated by things like equity, gender, Indigenous knowledge systems, as well as our ability to meet the Sustainable Development Goals. So across these different health outcomes, we're looking at how the social determinants of health modify or mediate how climate change will be impacting the health of populations in the Americas. In the second half of the report, we're looking at adaptation and mitigation solutions with regards to health outcomes. Specifically under adaptation, we're looking and showcasing and highlighting different adaptation assessment tools that decision makers can use to assess how climate change will impact health. So this includes things like the BRACE framework, which was created by the CDC in the United States, also looking at different vulnerability and impact assessment tools that are available. Really importantly, we're trying to use the literature and evidence available to interrogate the efficacy of different adaptation options and responses. And this is really an emerging area of research, and it has really important implications for decision makers deciding which adaptation strategy actually yields the best health outcomes in the context of climate change. In this section, we also address the limits of adaptation. We're also looking at the impacts of mitigation on health outcomes, because it isn't enough anymore to just adapt to increase temperatures and changing climates into the future. We also have to reduce our greenhouse gas emissions substantially. So in our report, we look at the co-benefits to different health outcomes. For example, we have a case study in Mexico City that examines different methods and different approaches or tools that are being proposed that would reduce the heat island effect for that city and increase health benefits, but also reduce greenhouse gas emissions for the city. We're also asking the question, can health benefits motivate mitigation actions? So for instance, could COVID-19 considerations and economic stimulus packages incentivize decarbonization? And what does that mean in the context of health? As we went through our report and we assessed the evidence, we also highlighted research gaps. And there were important gaps in geographical coverage. Specifically, certain countries and regions were less covered than others. The United States definitely dominates the literature on climate change impacts and health for the Americas. There's less research in Canada, even less in Mexico, and even less in Central and South America. There's also important gaps between urban and rural areas, with a lot less research coming out of rural areas. We also identified gaps in research that looked at different social factors and how those social factors mediated or modified the way climate change impacts different health outcomes. We found that most research focused on the exposure-response relationship between climate change and different health outcomes. We found less research that looked at how those associations might change into the future under different climate change scenarios. And we found even less research that looked at how climate change might impact different health outcomes under different adaptation scenarios, as well as under different shared socioeconomic pathways. And based on this, I think it's really important that as researchers, we start to shift our focus from filling in those exposure response research gaps that exist in the literature to also really focusing on projections and looking forward at how climate change might impact health into the future, in particular under different adaptation scenarios and under different socioeconomic structures moving forward. What was really interesting was that when we started the report, we identified the geographic range that we had to cover as a huge challenge for us. How on earth could we possibly provide a concise assessment on climate change impacts on health when the geography was so different, when the cultures were so different, when the climate change projections were so different? But what we soon came to realize was that the diversity that exists within the Americas is actually a strength of our report, because despite this widespread diversity across the Americas, there are also a number of common underlying pathways through which climate change impacts health. And we were able to comment on some of those more generalized learnings that comes from the literature and can inform decision-making moving forward. So what initially started out as our huge challenge actually turned into the huge strength of this particular report and something that we're really excited about. And with that, I'd like to thank you for your attention, and I really do look forward to the discussions and the breakout groups. Thank you very much.
Yes, thank you, Sherilee, for this presentation on the situation in the Americas. And this leads me to our last presentation from the regions, which is on Africa. And I will also share my screen with you for this one.
Greetings.
1 second. And as always, feel free to ask any questions in the Q&A tool. Those will be addressed right after this presentation.
Greetings. My name is Dr. Deoraj Caussy, and it's my pleasure to present to you the regional perspective on climate change and health for Africa. As you know, the African continent is the most vulnerable to the impact of climate change, despite being the least emitter of greenhouse gases. Why that situation? Well, first of all, it's due to the vulnerability that we have. 60% of our land mass is dry land, 38% of which is desert, 50% of the population live in the arid, semi-arid, and dry, humid, and desert lands. On top of that, we have low adaptive capacity caused by high rates of poverty and technological constraint. Now, the climate change have resulted in a number of climatic hazards, such as rising temperature, extreme weather condition, sea level rise, that result in a number of health consequences, including cardiovascular diseases, infectious diseases, undernutrition, and NCD. The map on the center shows the vulnerability is not evenly distributed across the continent, but because the topology and the social determinant are different at different locations. To illustrate this, I've chosen a few examples. The first one I've chosen is the impact of rising temperature. Africa has been described as a continent on fire. The inset map on the left-hand side illustrates the number of heat days that were projected due to modeling in 1960 and in the year 20 in the inset B. The main impact of this increase in number of heat days will result in number of deaths that can be attributable to the increase in heat. This will be particularly felt in sub-Saharan Africa East and West, as shown on the table on the left-hand side. Other major impact that will result will be cardiovascular diseases, increased occupational hazard, such as in outdoor jobs, such as mining, agriculture, which form a major part of our economy, and that will lead to decreased human productivity, of course, will exacerbate poverty. Do we have any solution? Well, we can start to model the health impact so we can anticipate it. We can insulate houses by using in-house green technologies, the public building and houses. And on the health side, we can institute early warning system and strengthen the health system to cope with the added burden. The other example I've chosen is the impact on vector-borne diseases. I chose malaria as an example. The 4 inset graph on the left-hand side The topmost two shows the temperature fluctuation with time, and the two bottom one shows the number of relative density of mosquito reflecting those temperature changes. The temperature change and the density of mosquito mirror each other. In other words, when the temperature goes up, the number of mosquitoes goes up. Then we have on the right-hand side with the projection on number of days that are susceptible to the multiplication of the malaria mosquito. This projection for the world, and you can see on the top of that is Africa in the blue, dark blue line. What impact it will have? Well, it will have impact on other malaria is just one of it. That we have other vector-borne diseases like yellow fever, dengue, chikungunya, Zika, and then we have the Rift Valley fever that has both affect both people and animal. Therefore, that can affect livelihood and food security, in addition to the other medical complication. What solution do we have? We can use, like in the case of heat, we can do modeling, institute early warning system, strengthen health system. But to deal with vector-borne disease, we have to approach it in an integrated management of vectors strategy, for which we need to institute and implement the health in all policy. The other example I've chosen is agriculture and food security. 60% of the food supply are locally grown, and the rest are from either imports or from food aids. Now, climate change will negatively impact food crop production for the world, as shown in the map, global map, but Africa is right in the middle there, so Africa will also be negatively impacted. The main climate changes: flood, drought, and pest. They will lead to crop failure. That will impact livelihood and food security. Of course, will exacerbate poverty, but there will be malnutrition, and with that will be attributable death, increase of death in the sub-Saharan East and West region. Absence of readily available healthy carbohydrate source will drive the population toward high energy-dense food by the year 2030. That will put an additional 118 million people at increased risk for oil and city. Do we have any solution? Well, we can change the farming practice. We can change the dietary habit, such as consuming less protein and looking for new sources of food like insects and microproteins. Now, our research have identified a number of cross-cutting themes that is common to all the sectors. We promote the use of modeling that will enable us to do a vulnerability assessment. We also promote collaborative research that will enable us to establish the co-benefit of mitigation and adaptation strategies, an area that is, we have very few information for Africa. We also highly endorse the public health package, strengthening the health system, instituting early warning system, and we endorse including climate change in the disaster risk reduction. Also incorporating health in the National Adaptation Plan. We have to look for alternative technologies that I've already mentioned some of them, like planting fire-resistant trees, and depending less on the domestic solid fuel. We need to endorse the policy support at all levels. However, we have persistent challenges. We have weak health system with limited resilience to detect, monitor, and treat climate-sensitive diseases. We have limited experts. Most experts are outside Africa, so we got to promote partnership and research. And then we have the ever constant threat of emerging diseases. We have the impact of Ebola, cholera, and now COVID-19. In face of all this, we have to rebuild a green economy. So we're dealing with a triple burden of communicable diseases, non-communicable diseases, and disaster due to climate change. In conclusion, climatic hazards and health impact are present to harmful level in Africa. Our strategies to mitigate and adapt are limited. Unmitigated climate change will widen the inequity gap, will hamper attaining universal health coverage, will slow down attaining SDG, and therefore we need to partner in this quest is a battle that we cannot fight alone. I thank you for your attention.
Yes, I would also like to thank you, Deoraj, for this presentation on Africa. And now I would like to ask all the speakers who have just presented to please turn on your videos so we can go into a panel discussion with answering any questions that the attendees may have. So attendees, this is your chance, your time. If you have any questions to the speakers that have just presented, or if you have any other issue that hasn't been addressed that you think needs mention at this point, please use the Q&A tool to pose these questions. At the moment, there is one question left in the Q&A from before. Oh, yeah, actually, there's a new question. This is, I guess, directly to Deoraj. And the question is, why is Africa described as a continent on fire despite being the least emitter of greenhouse gases? And what is the solution? Deoraj, if you could unmute.
You want me to answer that now?
Yes, if you could, that would be.
Would you like me to answer that now? Okay. Well, it's there are two things I said. One is we are the least emitter of gas, but we're the most receiver of the brunt of climate change. The other one, we say we're continent on fire because the burning of the bushfires, of the coal, of the domestic fuel, wood. So we are, and then our deserts always are lit up. So we, has been described by one of the authors, we are continent on fire. And then we get the flaring of the gases in the west, in the delta of Nigeria and all those. So taken together, it's more of a, but we do have a big contribution of bushfires and heat.
And do you also have any ideas on what could be the solution to the continent on fire being a problem as the, yeah.
We got to look for mitigation and adaptation. Get at the sources where we are emitting those fires. We're going to reduce them. Like what I mentioned is planting fire-resistant trees, but it's easier said than done. Then you can bring in, you can disrupt the local ecology and bring maybe pest trees. But the other one is to change the pattern of domestic use of fuel. Get clean stove as opposed to using those coal. And then again, the savannas, we get to address the savannas where most of the fires take place, also bushfires, to contain it such a way that we have fireproof and corridors, the fire doesn't spread. We get to go from the policy to right to the citizen. We get to get the citizen interested because they are the one who are doing on the field. Mm-hmm. And that knowledge, there's a gap in there.
Okay. Yes, there are a few more questions for Deoraj, but maybe Deoraj, you can already take a look at them in the Q&A tool. And while you do so, there is a question also to other speakers. And I would like to maybe ask Andy Haines now to take over the moderation of the panel discussion. So Andy, an anonymous attendee is asking, what is your opinion to those who are still do not believe in climate change? So do you also have a message to those, or is this not addressed at all in the report?
Shall I direct that to one of the panelists?
Yes, that would be great.
Maybe then I'll ask Sherilee to respond to that. I mean, how does one address this issue of climate change denial? Because skepticism is something we're all familiar with in science. Science is about organized skepticism, but there are some people who are still denying the facts of climate change. Should we try to address them, and how? If so, how?
Yeah, I think that's a really good question. And as you mentioned, as scientists, we deal with this across topics, and we're certainly seeing that with the COVID pandemic right now as well. I think there's a lot of different ways you could address this. So I'll kick us off, but other panelists might have other suggestions as well. I think one of the tools that I personally use most commonly is I try to find a little bit of common ground with the person that I'm speaking with. So for instance, I tried to learn more about that. And so my grandfather actually was a climate change denier for a very long time. He was a farmer. And one thing that finally sort of opened his eyes to the idea of how the extent to which the climate was changing was looking at the farmers' almanacs and looking at how those were changing over the years and how, you know, what and when he could grow and plant things was actually changing. So that's an example of speaking to people on a personal level. If I'm speaking to someone who maybe is somebody who really likes to exercise outside a lot, maybe somebody who does like marathons or something like that, in the city of Edmonton, where I'm located right now in Canada, we experience a lot of air pollution due to forest fires, which is increasing with climate change. And so talking to them about what it's like to be running outside in those conditions and how it impacts them and their health and their day-to-day decision making. So trying to bring it down to them on a personal level can be really effective, but there are a lot of different ways that you can grapple with this. And there's a really good TED Talk by Catherine Hayhoe on this topic that I'd recommend people to check out online as well.
Great, thank you very much. Ismail, could I also turn to you and ask whether this is also an issue in Turkey? How do you deal with climate change denial or extreme levels of skepticism which go beyond the normal boundaries of scientific discussion and doubt?
Could you ask again? Excuse me.
Some people are denying that climate change is happening. They're saying it's not happening, and therefore we don't need to do anything about it. Is this an issue in your experience in Turkey? How does the science community in Turkey react to people who say climate change is not happening, we don't need to do anything?
Actually, in Turkey, in universities, in research centers, we have research centers on climate change, and they are working on this. Minister of Environment and also Minister of Health now is doing some studies and taking some actions on this. I think people who is not living climate change is at a very low ratio. I think it's happening because during the last 20 years, extreme weathers increased too much, and I think we are experiencing it nowadays. Yes.
Thank you. Yes, I think there is probably, certainly in many parts of the world, probably a decline in people who are actually saying it's not happening because it's now obvious that it is. There are some people who say it's not due to human activities, but there I think also is declining because the evidence is so strong. But there will always be a few people who will deny reality. And I think that probably we can't spend too much time on this very small proportion of people who are going to deny reality, whatever you say to them. But it is an important issue for scientific communication, I think, and particularly working with younger people, with school children, with university students, early career researchers. They're often better informed, I think, than middle-aged and older people who don't have such a good scientific background. So a very, very important issue. Are there any other, there's one question about the Amazon. Now, we don't actually have anyone here from Brazil, but there is a question about the Amazon and what the effects are in the Amazon. Sherilee, do you want to comment on that?
Yeah, sure. The Amazon is covered in our Americas report, and it's a very interesting place actually because it's, well, first of all, it's huge, but also depending on the area of the Amazon, the climate change projections are really quite different. In some areas, we're expecting to see substantial decreases in precipitation and drought, which could lead to tipping points and desertification. But in other areas of the Amazon, we're expecting to see a lot more precipitation falling and huge flooding events and much more extreme El Nino events as well. So the Amazon's this really interesting place where we're seeing a huge diversity and wide range of climate change impacts on the local ecosystems and environments. And that has a huge range of impacts on health. Everything from flooding events, which could increase risk of injury, to increased waterborne disease. A lot of different vector-borne diseases are of concern right now. Nutrition, especially in indigenous communities where local food sources are changing substantially because of those environmental changes, heat stress and heat stroke, you name it, considering the huge area of the Amazon and the wide diversity of climate change impacts, we're expecting to see a wide range of health impacts, some of which have already started to manifest in the area.
Thanks, Sherilee. Yes, I mean, and of course, the other big concern is that the Amazon starts to shift from being a net sink of carbon to being a source of carbon. And once that happens, and it may be happening, now or very soon, then the danger is that that can't be reversed. So it is a very important part of the world, both because of its potential importance for the world's climate, but also because it's undergoing really unprecedented rates, or they've now started to go up again, the levels of deforestation. I know we're running out of time. Just one other very quick question that's come through about the difference between urban and rural populations and the different vulnerability. Maybe I'll turn to Robin there. Do you want to comment on that, Robin?
The difference between urban and rural populations. Well,
yeah.
Okay, one clear concern for the urban populations is the potential for cities to act as heat islands, where the local temperature within a city is higher than in the surrounding countryside. This may well exacerbate some of the impacts of climate on health with regard to direct heat-related morbidity and mortality. And we've seen that in some of the European data for heat waves, and I think it's found around the world. So that's one issue. There are other perhaps confounding factors or other mediators that need to be taken into account. So, for example, in rural areas, impacts may be particularly high on those working outside, subsistence farmers, for example, and your own work on heat and humidity-induced problems for labour clearly may have more of an effect on some rural populations than their urban populations, because urban populations may be able to work inside and apply air conditioning, but of course that creates its own problems. So I think the short answer to the question is that there may well be distinct problems both for urban areas and rural areas, but broadly everybody is sharing to some degree but the adverse health impacts of climate change worldwide.
Thanks very much, Robin. And there are a couple of other questions in the Q&A which we don't have time to address at the moment. One of them is to you, Robin, about the types of organisms released from the ice in the Arctic region. So perhaps you could just answer that by in writing. And there's one of the opportunities to collaborate with health professional organizations, which maybe Sherilee could respond to in writing, but I'll also mention it very briefly in my presentation as well. So I think, Johan, I'd probably able to get on with my presentation and try and keep it short, because I know you want to try and get back on time. So let me share my slides very quickly. Hopefully you can see my presentation, can you?
Yes.
Good. So what I'm going to say very briefly is to give you a kind of overview of some of the current issues around policy, climate change and health and policy. Obviously quite a strong focus on COP26 in Glasgow, because that's an upcoming event this year, which is really focusing public and scientific and political attention on climate change, and we hope climate change and health as well. So although we don't yet know whether Glasgow will be a completely in-person event, or whether it will have a very partly virtual element, which I suspect it will, clearly there is going to be a major event in Glasgow in November. There will be a conference in early November organized by the World Health Organization and the Global Climate and Health Alliance on health and climate change. That will be outside the official kind of conference boundaries. There'll also be a range of events in the green zone, which is open to the public, and the blue zone, which is open to the negotiators and official delegates on health and climate change, but they haven't been selected yet, so we don't know what they will be. So the UK government has a number of campaigns in the run-up to COP26. There are 5 main campaigns that are shown on this slide. One of them is adaptation and resilience, which is to encourage greater political ambition, finance and tools on adaptation and resilience. The second is the energy transition, seizing the opportunity to decarbonize the energy system quickly, because of partly capitalizing on the rapidly falling renewable price. Clean transport, accelerating the transition to zero carbon road transport, phasing out petrol and diesel engines. Nature, protecting and restoring natural habitats to act as partly to contribute to climate change adaptation, but also mitigation as well. And then of course, finance, which is absolutely crucial to achieve many of the COP26 objectives. So transforming the financial system to reflect the need for rapid action on climate change. And of course, in terms of health, investing in climate resilient health systems, but also decarbonizing the health systems themselves. And I'll mention that briefly. So none of these are specifically on health, but they all have very important health implications, as you can see from the bottom of the slide. Healthy transport systems can improve health through reduced air pollution, increased physical activity. Nature and ecosystems can have a number of beneficial effects on health, including mental health and physical health. So lots to be done integrating health into these 5 broad campaign themes. And we also understand that increasingly and somewhat belatedly, the British government is also seeing health as an important component. So although it's not part of the 5 official campaign aims, it will have a much higher profile at this COP than it has under previous COPs. Not just the health benefits of decarbonizing the economy and better adaptation strategies, but also what can be done in the healthcare system. So in terms of adaptation and resilience, there's going to be a lot of work building on the call, which has been very widely endorsed by over 100 countries for action on adaptation and resilience, increasing the availability, efficiency and accessibility of adaptation and resilience finance, and reducing the cost of disasters, stimulating and catalyzing urgent on-the-ground adaptation. It's important to say that many adaptation strategies don't really consider health, and that's really dangerous because sometimes that results in maladaptation. In other words, adaptation which actually has unintended adverse consequences, either by increasing greenhouse gas emissions, like, for example, increasing air conditioning. If you just put lots of air conditioning in, you may reduce heat-related deaths, but you'll also increase the load on the electric grid. You will increase emissions of greenhouse gases, and you will increase the urban heat island because you've got to pump the heat somewhere, you pump it outside the buildings. So integrating health into adaptation is crucial. There's the energy transition campaign, which has 4 elements. Most urgently, phasing out of coal power, because we know that 80% of coal has to remain in the ground if we have a reasonable chance of keeping well below 2 degrees, which is what the Paris Agreement tells us we should do. That means reducing international coal financing, preventing and reducing the contribution of the financial sector to investments in coal, and of course, capitalizing on the declining costs of renewable energy, particularly photovoltaics, but also wind energy as well, which are increasingly competitive with coal. And if we stopped subsidizing fossil fuels, as unfortunately we do, we don't pay the full economic cost of them, then of course, renewables will be able to contribute and compete much more effectively. So establishing this new financial framework to take us away, particularly from coal, but also oil and gas, is going to be crucial. Clean transport, obviously underpinned by the health considerations. Emissions from cars and vans make up about 7% of the global total at the moment, but it is increasing very rapidly as more countries take on board and increase their use of the private car. So there needs to be a rapid global shift to zero emission vehicles in the UK. They're using the COP26 presidency to try and push for all, making all cars zero emission by 2040. But in cities, of course, particularly, we need to emphasize the need to use public transport rather than everyone driving their own car, but also promoting active travel, walking and cycling, because physical inactivity is also a major killer. About 5 million people a year on average die of physical inactivity, die of diseases caused by physical inactivity. So big benefits from that. Nature, we now appreciate nature has such an important role in human health, both mental and physical health. And the COP26 Nature Campaign aims to build a new dialogue on sustainable land use, reducing deforestation, reducing agricultural monocultures, and investing in sustainable production, new markets for more sustainable crops, delivering increased finance for nature-based solutions. Nature-based solutions can be very varied, everything from wetland protection, mangrove, for example, which can reduce flood risks, protection of forests to reduce biodiversity loss and also reduce air pollution from wildfires, and so on. But designing these nature-based solutions with health in mind is important, because if you design them badly, you can make health worse. So, for example, if you protect wetlands close to cities, they can harbor disease-carrying mosquitoes, which can increase the risk of disease. So one needs to always think about health when designing adaptation strategies. And you can see that it isn't just land, also the ocean's role is increasingly recognized. The ocean is a major sink for CO2, and it helps to, it's also a heat sink as well. And there are important implications of some of the ocean strategies around fisheries, more sustainable use of shellfish, crops, seaweed, and so on from marine sources can also benefit health directly and indirectly. We're also realizing the healthcare sector is a major emitter. If the healthcare sector was a country, it would be the 5th largest emitter of greenhouse gases on the planet. NHS England has now committed to net zero emissions by 2040 for these direct emissions, the fossil fuels that are burnt on the sites of hospitals and other healthcare facilities, and 2045 for indirect emissions, so the electricity that it buys in, the transport that transports patients and staff to health facilities, and of course pharmaceuticals. Pharmaceuticals are very energy intensive as well, producing pharmaceuticals and medical equipment. So working on procurement policies, working with the private sector to ensure that they decarbonize their supply chains is an important part of decarbonizing the health sector, as well as reducing single-use plastics and other materials, moving towards asthma inhalers, for example, which don't contain climate active substances, moving towards powder inhalers and a range of other subjects. So in conclusion, as you know, each country is supposed to present its nationally determined contributions. Is doing so over coming months, actually, but a little bit delayed, but it's supposed to be, many countries have done so or are doing so. These national contributions reflect their contribution to reductions in greenhouse gas emissions for the Paris Climate Agreement. And we know that there's also an opportunity to integrate health into these nationally determined contributions, and the publication on the slide illustrates some of the work that WHO has been doing with national governments to increase the integration of health in these NDCs with the aim of accelerating ambition for decarbonisation by capitalising on the health benefits of lowered air pollution and some of the other benefits we've talked about as well. So using these NDCs and the health benefits of the NDCs to increase the ambition to decarbonize the economy is an important goal over coming months. And so in conclusion then, there's a real opportunity for health voices to be engaged in this so-called race to zero, which is a coalition of 120 countries, over 1,000 businesses, many universities and cities, which have undertaken to decarbonize their activities over coming decades. We need to reach net zero by 2050. Unfortunately, we know that the current NDCs and nationally determined contributions are not sufficient to enable us to get to zero in that time period. So the voice of health professionals is going to be really important. And one of the questions in the Q&A function was, what role can health professionals play and how can we get involved? And there are a number now of activities. both through the conventional health professional bodies, the World Medical Association and others, but also through networks like the Global Climate and Health Alliance, GCHA, which you can find on Google, which also coordinates a whole range of health professional organizations around the world. And that's important because nurses and doctors are amongst the most trusted members of society. So when they advocate for rapid action, it's more likely that the public and opinion formers and decision makers will take note. So I'll stop there, Johanna, and I'll hand back to you to introduce the breakout sessions.
Yes, thank you very much, Andy, for this presentation on the policy issues that we currently face or the developments that we have seen in the last years. Andy, if you could stop sharing your screen, then yes, thank you very much. So now we will, as I already said in the beginning, we would like to have a discussion, an actual discussion with the attendees. And since this is not possible in the format of a Zoom webinar, we would now like to provide a room for exchange in a separate Zoom meeting. We will, in this Zoom meeting, we will then have 4 groups, which will discuss either mitigation or adaptation solutions. All attendees will be assigned to these groups randomly. All of the groups will have a moderator who will guide the discussions, and we also have rapporteurs who will report back to the webinar once the breakout sessions have ended. Now, the most important information for you all is how do you join these breakout groups? So my colleague Annika will now post in the chat a link, which we ask you kindly to click on after I finish talking. And this link will lead you to leave this Zoom webinar and to join another Zoom meeting. And in this meeting, we will then be able to have the breakout discussion. The breakout discussion will last for 30 minutes, and afterwards you will all return to this webinar for a final discussion. The breakout sessions will start in 8 minutes, so at 6 p.m. CET, or I guess this would be 11 a.m. US Central Time. So please join this Zoom meeting now, and then you can take a break, get some coffee, get some tea, and then we will start with the breakout sessions in 8 minutes. And so see you all in a bit in the other Zoom meeting. So I think I will now hand over to Andy, who will moderate the reporting back from the breakout sessions and then also the discussion afterwards. Andy.
Okay, thanks, Johanna. So I'll just call people in the kind of order they appear on my screen, if that's okay, the rapporteurs. So I think Peter is the first one on my screen anyway.
Okay, thank you, Andy. So I get the dubious honor of being the first rapporteur with little time to put my thoughts in focus. So just to say that we were a group, we were about, let's say, 7 to 10 participants, moderated by Claudia Conales from the IEP Climate Change and Health team. And we were discussing sort of adaptation. And a lot of the discussions actually focused around public engagement and how to, this sort of top-down idea of governments putting in place policies, even, high-level scientists like academies advising governments and the public what to do. But there was a lot of comments, I think, insisting that community groups, youth groups, NGOs have to be involved in the, let's say, the co-production of policies and of projects in how to implement sort of adaptation responses, if you like, in cities or in rural areas or elsewhere. There was a few examples given of, especially in cities, there are large data sets that probably already exist on qualities such as air pollutants and so on, whether these are the environmental agencies or the public health agencies. A lot of data sets that could maybe be linked together and analyzed together, and to show trends, what is going up, what is going down, these kind of things. So that in many cases, the data might be there. There was also related to this a little bit, many public health schools use something called community health assessments, where they're surveying different communities at different times to find what is of importance to them in the health arena at that particular time. And it was proposed that this sort of community health assessment model could be used to check on, even in rural areas, to do with burning stubble in fields or droughts and water shortage, things that could be related to climate change health issues, and sort of engage the communities that way. And there was obviously the thought that when communities are involved in the co-generation of the solutions, those solutions are much more likely to be implemented. And maybe the final point is, again, maybe back to the top-down approach, but saying that organizations, international organizations especially, one of the example of PAHO was mentioned in the Americas. It could also be applied to IAP in a certain way, do have the power of convening, to bring the policymakers together with the scientists to listen to the scientific recommendations, but also those discussions, even no matter what high level, they should include community members, relevant NGOs and so on, so that any solutions are really thought through and worked out together. Let me leave it there.
Thank you, Peter. No, that's a great summary and some really important points. And I'd like to encourage those listening to start formulating some questions to the rapporteurs. So please feel free to put them in the Q&A or in the chat. Next, I think, is Bisma.
Hello, everyone. So we worked on mitigation, but we also kind of covered adaptation in one of our main questions. So the first thing we wanted to understand was examples of how to quantify the benefits of adaptation and mitigation. So we discussed there were a number of approaches that could work for this, measuring carbon dioxide and other pollutants. So for example, there is a process where you can kind of measure atmospherically by taking out greenhouse gas emissions from the atmosphere and other pollutants, and then have a better understanding of how many deaths may have then been mitigated. So that was a really interesting point. Also monitoring real-time air pollution, household air pollution, and then maybe even using population surveys to measure the activity at more of the local scale, or even dietary intake rate, because all of these different factors are involved. We did know it may be taxing, but these things can be done and they can be measured. So it's important to keep that in mind and have a positive approach. One of the individuals in our breakout room also talked about kind of what this all means for sub-Saharan Africa, which we thought was a good point. And one of the overarching themes that we want to understand is, right, sometimes the places that we need to understand the most have the very least amount of data available. And although there is very little data available, there is more local level effort to understand at the African level what is the data and how can we use it. And maybe within the next couple of months and years, we can have more information there. There's also an opportunity here in the sub-Saharan Africa and the rest of Africa to build resilient communities and have actual designs where we can already mitigate and adapt at the same time. So over the long term, Africa can establish as a more resilient kind of continent in that regard. There was also a note on how the next COP may be focused more on Africa and zero carbon development there. So that's something to keep in mind. The second question we focused on was kind of what Peter was talking about the local level, the general public, how can they be involved? What can we do? So there were a lot of points noted about action happening at the sub-national level. So mayors and local leaders being part of the action. And what is great about that kind of level is they can improve building regulations, sustain green space, talk about transportation in different ways and strategies to mitigate emissions, but also healthy food consumption, which I thought was really interesting. Other people or other actors that are involved, citizens groups, there's an approach called the zero carbon towns and settlements, which is extremely bottom up. So ways in which citizens can actually take action for their own kind of health within their community. There's also a growing movement of healthcare professionals, and very interestingly, we had someone from Healthcare Without Harm as part of our group, and they shared with us kind of how this global NGO is involved with helping with the healthcare sector and greenhouse gas emissions, or more of the climate change focus there. So basically, they can not only talk about the European level, but the global scale. And the European level, at the very least, there is strong climate health policy, but at the same time, it varies across, just like within every other continent. And then one thing that they did note also is that hospitals are really interested, and people within the hospital level are getting involved. So although COVID has been a huge influence or focus within the healthcare sector, that does not mean that education hasn't, not education, that doesn't mean that climate change and the way we see that has been put on the back burner. And then last piece on just COVID-19, I think is a really important point that our breakout group made, was how has that kind of changed the way that the world is operating towards climate change. And really what we wanted to note is that COVID-19 has prompted people to think about a green recovery and what that may look like. And that's maybe the last point I'll end on, and how we can kind of think about ways in which strategies can not only support climate change, but also in a way where we're not increasing inequalities. So thank you.
Great. Thank you so much, Bisma, for a very comprehensive summary. I'll move on to Shada now.
Hello, everyone. So we were discussing a few specific examples of how the public can get involved in both climate mitigation and adaptation efforts. And we were looking at citizen science. So how they can possibly use social media to record things that they notice and then report it. So we also more specifically went into the track and trace system, which, although faces difficulties in implementation, does have potential use for the future. So we were looking at the benefits of using technology and how the public can use that. We're also looking at crowdsourcing in early warning systems, which can give a general sign of change in, for example, urban settings with the development of heat islands. And then we were looking more about how we can engage the public, just as they're in a very good position to enact change. So the importance of educating the public and translating scientific knowledge, as there's sometimes a disconnect between the science and action going on in the field. So we were talking about this mainly in relation to COVID, but we discussed how science has a role in creating an awareness. So it's important just to get that out there and explain how climate change does affect health. And there's also a benefit in using trusted figures who are on the front line as voices. This was in relation to COVID. So for example, doctors and nurses who are treating patients, but this could be used in relation to climate change and health. And then we were talking about misinformation. So we were talking about how we can spread information using the same methods that disinformation is spread. So for example, using social media, but when using social media, you have to be able to communicate and connect with people on their level. So the public understands and sees how it relates to them on a personal level. And you can achieve this by using relatable stories. And that can counter misinformation and interests that have been pushing certain narratives. We did brush briefly on a second question. So we were also looking at the local level. So we're talking about how it's difficult to achieve fast change on a national level. So looking at cross-sectional action might be achieved more quickly on a local level, for example, in cities, by establishing like green roofs or urban agriculture in the greening of cities. But those were our main points.
Great, thanks very much, Shada, for another very rich report back. And then finally, I will turn to Robin.
Okay. We were also quite a small group, but we had a productive discussion moderated by Nina and managed to answer 3 questions. There is some overlap with three previous reports out. We looked first at the question of how to think about research priorities, and we agreed that there were a lot of opportunities for addressing uncertainties, and of course, all of the regional working groups have explored what research priorities might be for them. As Ismail said, one of the priorities is to do more to understand about quantifying solutions, to understand which adaptive or mitigation solutions are most cost effective and can be scaled up. There's also quite a big research agenda associated with knowing how to scale up from local initiatives and how to identify the obstacles to implementation more broadly. So some of the answer to those problems does indeed relate with involving other stakeholders, and as Peter mentioned, so also at the research level, co-design of projects with farmers, indigenous communities, manufacturers and so on, do help to get buy-in from other stakeholders. That was the first question we looked at. Another question related to what are the options for the healthcare system itself to mitigate and adapt to climate change. This, of course, was a topic that Andy introduced in the context of the UK COP26 presidency and what the NHS is doing. And again, we agreed, as Shada mentioned, there is a responsibility for health professionals to lead the debate in a number of regards to stimulate wide discussion and action. Within the healthcare system itself, from primary through to tertiary care, there are a range of opportunities for mitigation. Some of these are associated with mitigation in other sectors, so clean transport, greener buildings, etc. And a discussion included an example from Malaysia on improving public transport access. But the point that we emphasised was that, of course, mitigation in the health sector, as in other sectors, in addition to potentially reducing greenhouse gas emissions, also may well bring health benefits for the local population engaging in the mitigation. Part of the discussion then went on to considering opportunities to gain those health benefits by using new healthcare delivery models, particularly digital health, to deliver care, particularly when physical health infrastructure may be some way away in remote rural areas in the Arctic, for example. And it's observed that certainly COVID-19 experience has accelerated the delivery of healthcare virtually, and this is probably something that will remain with us as a continuing mechanism. Also, just the last point on health systems, important to emphasise that preventive healthcare, of course, can also help to reduce the carbon footprint of the health sector. Most of that relates to mitigation in terms of adaptation and the health sector. Example that we need to be mindful when planning new healthcare facilities, for example, not to put them in the middle of floodplains. That won't help the adaptation to current and projected future change. And the third question comes back to this issue of cross-sectoral action. How can we promote it according to the concept of health in all policies? Again, this is something cross-sectoral that's really emphasised in all of the regional work. It's clear, obviously, with regard to a number of sectors. Transportation is one that's been mentioned, and urban planning. The problem, both for science and for policy making, is of course that a lot of the activities still located in traditional silos. How do one build that joined up policy across the policy silos and build up joined up transdisciplinary science? I think when we finished with one example that seemed a relatively timely and good example of cross-sectoral interaction, and that's the emerging one between sustainable food systems, nutrition, health, and we've talked about that quite a lot today, emphasised that solutions here do have to be context specific and culturally sensitive. For example, in decoupling livestock production from greenhouse gas emission intensity. And the point was that this year, in addition to COP26 and so on, but we have the UN Food Systems Summit. And this actually is a great opportunity for emphasising some of these cross-sectoral issues. So, thank you.
Thank you very much, Robin. So we're almost running out of time, but we do have a couple of questions. One on the chat from Stefano, who asks about, mentions the importance of linking global and local climate interactions and their impacts, and suggests that we need a powerful platform and an advanced analytical approach to doing this, and that big data and AI may show some promise in this respect, and they could help to support decision-making if properly configured. And I think the other point, which is kind of the other side of that coin, is about how can we resolve, from Vanetta, how can we resolve the lack of data in sub-Saharan Africa to better understand the effects of climate change and health at the community level. So I'm going to put those two questions to the panelists and ask anyone who's interested in responding to them just quickly to give their responses to those two really important questions. Anyone like to have a go? No takers at the moment. Shall I just very briefly then respond to the one about sub-Saharan Africa, because we are doing quite a lot of work with our African colleagues, not just through the IAP work, through with Jackie Caddo and the Network of African Science Academies, which Deoraj has been representing today, but also through other colleagues. Deoraj, do you want to come in on how we can build up capacity in Africa and collect data? You need to unmute yourself.
Sure. Thank you. We need to, my internet was also breaking down. We need to form the partnership because we are lacking in the expertise in areas like climate change, health scientists, to do the projection, to do the modeling. We depend most of it from the north or the south. So we need to enhance that collaboration between north and south. I think the academies have a big role to play in that. We start some, but they're very like isolated, like a parachute type of research. It comes, gets some data, and then goes up, and nothing gets done on a larger scale. So I think that's where some of the bottleneck is.
Thank you.
But also come just for limited purpose and not in the larger context of what good it will leave behind.
Yeah, no, absolutely. And I would like to say also that there are a number of significant research assets in Africa. So there's networks like the In-Depth Network, which is a network of demographic surveillance sites that collects regular data on populations in particularly sub-Saharan Africa, some in Asia as well. And there are moves now to link some of that population health data to climate. So that will, so for example, one of my colleagues has been working with colleagues in Burkina Faso to link climate, agriculture and health data, showing that increased temperatures and decreased rainfall in the future is going to have effects on child stunting and mortality. So it is beginning to happen, not at the scale we would like to see, but it is beginning, and it can be done more. We can do more of it in the future. And then AI, I agree, there is a potential. I mean, there's a lot of concern about AI, but there is also potential benefits from AI as well. One of the ways we're using that is to use AI to help with the synthesis of literature. Because when you try and do a literature research search now, you might come up with thousands of papers, and it's quite difficult to screen them by hand. So we're working with colleagues in Berlin to see if we can use AI approaches to screen very large bodies of published literature to try and pull out the papers that are very relevant, really, that we want to focus on. So I think there is some potential in terms of systematic reviews, literature searching, but also the analysis of big data linking climate and health data. But it's early days yet, and we're still working very much in that area. So I think we've got to come to an end. It's just a few minutes to go now, Johanna. I think I should probably hand back to Volker, thanking everyone for their great presentations, the rapporteurs from the breakout sessions. I think we've had a very stimulating afternoon. Johanna, is there anything you want to say before I hand back to Volker? No, I think that's it. I also just would like to thank from my side all the speakers who were part of this and all the attendees for their questions. And yeah, I will just leave the final words with Volker. So yeah. Thank you.
Okay, everybody. I have to admit before I thank everybody that when we discussed this in our group, whether we should have such a webinar and discuss this, I personally was not sure whether we actually have enough to present to you. Because we started this already 1.5 years ago. Through COVID, everything was delayed. And my concern was, is this really enough we can report? Would we really be attractive enough to get an interesting audience, which we need to discuss? Would the breakout group actually work? And would the technology really keep going until the end and would not collapse? Well, all these questions have been answered very positively. I'm very impressed by the presentations. I really must say everyone did a fantastic job. And even the breakout group, which is so important in this discussion, and as it turned out, actually gave us additional information, which is worthwhile for our own work, was fantastic. So I would like to thank all the speakers. I would like to thank the breakout groups and the participants. And I would particularly like to thank Johanna for managing this and keeping this always with a smile. You never got nervous. Everything worked. And I must say, we will do it again. I think, thanks everybody. I hope you can relax now and don't have another video conference right after this one. I think for us it's time to close it. Thank you very much.